Thank you for reviewing MedicalGPS's Service Improvement Program. Endeavor for Excellence, start where the patient starts. During this step, step number 8, we'll be covering scheduling protocols, patient flow, and exceeding patient expectations. To get started, I'd like to bring your attention to an article from Medical Economics. The title of the article is 5 Ways to Optimize Your Patient Schedule for Efficiency. I'll briefly review these 5 steps with you today. I would encourage you, however, to download the article and then use it with your team, dig into each of these steps, and then implement process changes as needed to help optimize the schedule efficiency at your practice. There's a link to the article in the comments section below. Step number 1 is to prioritize complex visits. Work with your providers and then develop categories of visits based off of their complexity. Then educate your staff on how to recognize those complexities and book patients accordingly onto the schedule. Step number 2, create an organized triage process. What you're going to do in this step is develop a list of the 20 most seen or recognized symptoms presenting by your patients. These 20 symptoms then will allow you to develop a matrix by provider so that you've got providers across the top of the matrix and you've got symptoms down the left-hand side of the matrix. And then you're going to get input from each of your providers about how to best handle each of those patients as those symptoms are presented. This triage chart will allow your support staff to be empowered to either work patients in or book them onto the schedule as needed, or perhaps to get them advice from someone within the practice. Sometimes the providers might want to provide a phone call back to the patient, or perhaps the provider's nurse or MA. Again, this metrics will be very unique based off provider input and the 20 most recognized symptoms at your practice. Thirdly, manage phone calls. Phone calls will oftentimes interrupt and slow down the scheduling process. Much like you did in step number 2, in step number 3, you're going to categorize phone calls into different types based off of input and feedback from your physicians and your providers. As those phone calls come into the system and are taken by your receptionist, use the phone call types to process the phone call, take a message, or otherwise put the message through directly to the doctor's MA or provider's MA or nurse as needed. Again, a way for your scheduling team to be empowered to handle phone calls or manage them at the first point of opportunity. Fourthly, work toward open access. While this is not possible for every subspecialty and specialty type, oftentimes open access is needed to be able to handle patient needs as they presented. So again, working with your providers, create some open access on the schedule as much as can be created. And then lastly, use quick huddles. So as the day progresses, there's going to be times throughout the day where you need to regroup, your team needs to regroup and understand what's happening with the schedule and where patients need to go and what the need of patients are. So much like you start the day with a team huddle, have many MINI huddles throughout the day so that your team can be empowered to adjust as needed throughout the day. As we wrap up today's video, and as you're revisiting and developing provider-driven appointment scheduling protocols, I'd like to leave you with a list of 12 deadly sins that kill efficiency. You can use these perhaps as red flag opportunities to go back and revisit with your team what's working and what's not working. I call these the dirty dozen or the 12 deadly sins that kill efficiency. The first one is, do you have provider-driven scheduling protocols in place? If you do, that's awesome. That is the foundation of this process. And are they clear? If they're not clear and they're confusing, that's a problem. So make sure that your support staff understand and they have a clear understanding of how to implement these provider scheduling protocols. Secondly, once you get the protocols articulated, make sure your staff are trained and then empowered to book appointments per the protocol. The idea here is you want to empower your support staff to be able to book the appointment as soon as the patient makes the request. So if it's at checkout or if the patient's calling in for a new appointment, as soon as that patient has a request, if that request can be handled at the very first point of opportunity without a message having to be taken or without someone having to give them permission to book the appointment, that indeed is the most efficient method. So support staff are trained, and then secondly, they're empowered to book appointments. Thirdly, starting the day late or starting late after lunch is a huge red flag. So if that's happening ongoing at your practice, call a team meeting, dig into what's happening, and then fix whatever's making that happen. If there's something there beyond your control, you may have to put procedures and methods in place to work around that, but I would encourage you first to understand what's happening, and if that lateness can be fixed or changed, obviously you want to do that. Lab work. Lab work is essential. Test results have to be available for your physicians, for your support staff, and for patients as they need those lab results. So look at that process. We talk about that in our messaging video, how to make sure that messages are handled appropriately and how to eliminate some of those messages revolving around lab results. So take a look at that. Make sure that lab results are flowing to the patient through your provider and your support team as needed. Here's a real basic one. Most of you probably have procedures in place, but if you don't, or if they're not working, revisit procedure room and exam rooms being stocked every day so that the supplies are in there and someone's not having to stop during the day to stock the exam rooms or procedure rooms. Be ready for unanticipated procedures. They're going to happen. If you haven't already, bring your team together, including your provider champion, and then think about hypothetical situations that may be happening, or review situations that actually happened not too long ago. And then those unanticipated procedures have plans and guidelines in place so that they can be handled as needed. Lack of late patient guidelines. So if you don't have guidelines around how to handle late arriving patients, you'll want to put those in place and then implement those accordingly. Ineffective handling of interruptions, like we just talked about, those unanticipated procedures and late arriving patients. Have those guidelines in place beforehand. One of those interruptions might be a support staff shortage. Since COVID, there's been a tremendous amount of shortage in support staff. It's probably happening at your practice. To the extent that you can cross-train members of your team to back each other up, you've probably already done that. If you haven't, that's a good opportunity to do so now. And otherwise, find ways to support your team. It might involve outsourcing. It might involve some long-term solutions to support staff shortages. Whatever those are, if you haven't already, begin to work on how to support your team so that those shortages are not so chronic that it stops the operation from happening. Starting the day with a team huddle, I emphasized that in previous videos as part of Endeavor for Excellence, service improvement training. It's hugely important. Having those during the day mini huddles also are very important. Look for patients and or providers that are spending a lot of time with patients, and if those patients routinely are taking too much time, work with your providers and the patient to see what can be done to try to keep that from happening. And then lastly, if you find opportunities where providers are doing, quote, too much of the work themselves, maybe they're handling all of the messages at the end of the day, maybe they're providing permission to book appointments too often, those are opportunities to retrain support staff and work with your providers on delegating that workload so that the provider themselves don't become the bottleneck. So look for opportunities so that providers can delegate workload appropriately. Again, if you have questions or if you need assistance, please feel free to reach out to us here at MedicalGPS. We'd love to hear from you. Thank you.